India has developed rapidly in the 21st century. But the country is facing serious healthcare challenges. Despite a growing pharmaceutical industry and availability of modern medical equipment, our lifestyle is becoming increasingly unhealthy. And without a healthy lifestyle, it is easy to fall prey to a lot of diseases, leaving people with a sense of low productivity and depression. The most significant medical challenge faced is with non-communicable diseases, commonly known as NCDs. NCDs are not only the leading cause of death in the world, but are also responsible for 60% of all deaths in India. The majority of these deaths were attributed to cardiovascular diseases, diabetes, cancers, and chronic respiratory diseases. An unhealthy diet, physical inactivity, and tobacco are some of the leading risk factors for NCDs. According to the National Cancer Institute, smoking and second-hand smoke is one of the leading risk factors for cancer and cardiovascular diseases, diabetes, and COPD. Compounding the problem of an unhealthy lifestyle is an unhealthy diet. Eating has never been and never will be simply about satisfying physical hunger. Food has a deep emotional connect and is often the refuge sought to deal with emotional upheavals. An increasingly sedentary lifestyle coupled with the stress of urban living often drives people to excessive eating and unhealthy choices, which give rise to uncontrollable weight gain or obesity. The commercial food industry is geared towards taste over health, and eating out generally entails feasting on food prepared with excessive oil, butter, salt, and sugar. These taste enhancers ensure a delicious meal, but result in a very unhealthy calorie intake. Fast food, invariably the food of choice with today's busy lifestyle, is the prime culprit for rising obesity. Long working hours, hectic lifestyles, and modern conveniences couple this rising trend of fast food consumption with a complete lack of physical activities. Any extra calories not burned off are stored as fat. The need of the hour is for families across the country to engage in calorie-burning activities for a healthier life. Building some form of physical activity into the daily schedule by taking the stairs, playing sports, will go a long way towards correcting an unhealthy lifestyle. Studies have shown that regular mild aerobic exercise 4 times a week may help lower cholesterol, reduce the risk of heart disease, and improve diabetes management. But often, people succumb to smoking and drinking to overcome stress, two lifestyle habits that lead to worse problems. They both cause multiple complications with ailments that can range from mild to life-threatening, the most lethal of them being cancer. In 2013, WHO, endorsed by World Health Assembly, has developed a comprehensive global monitoring framework for prevention and control of NCDs. And India was the first country to adopt this monitoring framework. Under the National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke, or NPCDCS, the Ministry of Health and Family Welfare vigorously started taking measures for awareness and prevention of NCDs. And this gave birth to the Swasth Chetna Abhiyan, which is a significant endeavor to improve national health. The Ministry of Health and Family Welfare set up awareness and screening camps for NCDs at the India International Trade Fair from the 14th to the 27th of November 2015. The India International Trade Fair attracts a large footfall from different sections of the society. Every year, millions of people visit the fair, making it one of the most popular fairs in India. This makes it an ideal location to carry out the awareness generation and screening campaign on NCDs. 7 health camps were set up at 7 different locations, keeping in mind areas of crowd concentration at Pragati Maidan. 6 of these camps were dedicated to common NCDs like CVD, cancer, diabetes and COPD, while 1 camp was devoted to oral health and cancer. Swasth Chetna Abhiyan focused on using innovative ways to generate mass awareness and carry out screening of NCDs. That's why these camps were designed to take care of a large number of visitors. Some of the top hospitals and medical institutes like All India Institute of Medical Sciences, Safdarjung Hospital, Lady Hardinge Medical College, Ram Manohar Lohia Hospital, Maulana Azad Medical College, LNJP, UCMS and NDMC participated in the campaign, assuring the best health checkups and screening to visitors. There was an overwhelming goal of 55,000 plus visitors, which was set for the event, which ran only for 14 days. The task was massive, but with the commitment of the government officials working day and night, hundreds of paramedics, doctors, counsellors and volunteers were deployed for the campaign, ensuring no visitor remained unattended. And the results were staggering. A recorded 70,000 plus visitors attended the camp, making it an unprecedented success. Not only did it cement the foundation of the Health Ministry's war against NCDs, but can also be marked as a significant step in making India a healthier nation, with a commitment to constantly raising health awareness amongst the citizens of India. This is the success story of those 14 days of hard work, endurance and selfless dedication. 7 camps were set up at various locations of IITF to ensure that the maximum number of visitors could be screened for major non-communicable diseases in a short period of time. Several factors contributed to the high attendance of people at the health camps, which made the campaign a success.
Good morning India, welcome to all of you State Camp. दोस्तों आज के टाइम में स्वास्थ्य सबसे बड़ा धन है.
The energetic anchors of health, with persuasive messages, engaged the visitors actively and assured maximum footfalls at these camps. The health checkup in these camps were carried out in 5 stages, giving every visitor a sense of the systematic processes required for a thorough health checkup. Registering at the point of entry with a unique serial number, every visitor first went through a BMI check. BMI or body mass index is a person's weight in kilograms divided by the square of height in meters and is used as a screening tool by doctors as it reflects how much a person is over or underweight. After completing the BMI test records, visitors moved on to stage 2, the blood pressure test, which was checked by the paramedic staff and carefully documented in the visitor's form. Stage 3 saw another team of paramedics testing and noting the visitors' random blood sugar parameters. Stage 4 included trained paramedics filling in a health and risk factor checklist. The final stage of consultation witnessed trained professionals guiding the visitors to the doctors, counsellors or cancer camp based on the interpretation of the finding of the checklist and registration form results. Visitors in normal conditions were forwarded to counsellors with the test results for consultancy on lifestyle, healthy diet, substance abuse and physical activity, and the importance of early treatment and diagnosis of NCDs. Diet being one of the important risk factors as far as NCDs are concerned, innovative ways of diet counselling were introduced to visitors, where the diet counsellors explained in depth the pros of a healthy diet.
Preservative, salt, sodium बहुत ज़्यादा है तो आपकी बीपी के लिए अच्छा नहीं.
Driving home the importance of nutrition is a cornerstone for a healthier India, and taking this forward was a unique diet chart, an installation prepared with different color coding to highlight various aspects of a healthy and unhealthy diet. If a routine counseling session revealed that the visitor needed a serious medical consultation, an orange sticker was pasted on his form and was referred to the doctor. Otherwise, they used a blue sticker and sent him to the counselor's table. During the camp, doctors examined thousands of visitors requiring medical attention and prescribed treatment as per their diagnosis. The doctors at the camps also informed the visitors about the special process set up by NPCDCET at various hospitals for further examination and treatment.
एम्स, आरएमएल, सफदरजंग, एलएचएमसी, आईसीपीओ, एलएनजेपी और जीटीबी. सफदरजंग मैं आपको ईएनटी ओपीडी में रेफर करूंगी, ठीक है. आईआईटीएफ से जो लोग जा रहे हैं उनको प्रेफरेंस मिलेगा. एक अलग सी विंडो बनी हुई है आप लोगों के लिए.
A dedicated camp for cancer monitoring served as a nerve center for any visitor showing any signs of cancer through the different checkup stages. A dedicated ambulance service was at hand for immediate action on the event of any visitor needing urgent medical attention or being at immediate risk. More than 1,000 visitors were referred to participating hospitals at IITF's 14 days operational camp. The medical camps were successfully designed to provide an end-to-end solution to the visitors, engaging them in such a manner that the core message of wellness was not only retained, but the visitors in turn became vehicles of change, spreading awareness towards a healthier lifestyle.
You have to control your weight because ये आगे जाके it will give you problem. All the lifestyle diseases.
The medical records of each visitor was maintained through a specially designed IT-enabled platform for the camps. This software digitizes data, creates traceability through a serial number, and allows research groups and concerned organizations access to this huge pool of data, enabling better understanding and treatment for NCDs. Recognizing the success of alternative and holistic medicines in control and treatment of NCDs, allopathic counselors and doctors also referred the visitors to practitioners of the Ayush system of medicine, which includes Ayurveda, Yoga, Homeopathy, and Unani. Keeping this in mind, Ayush doctors and counselors were deputed in each camp to strengthen the counseling activities for NCDs. They also filled the referral forms and referred the visitors to their designated institutes for further consultation.
इनमें से कोई हॉस्पिटल पास पड़ता है आपके यहाँ से देखो.
While other 6 camps were devoted to common NCDs, camp number 2 was entirely dedicated to oral health and cancer. Understanding that diagnosis is the first step towards treatment and the patient's battle may have to be fought over the years, a team of expert doctors made sure that visitors are well treated and diagnosed for any of the cancers, and proper referrals were made for further treatments.
पंडित जी नमस्कार. अरे नमस्कार जजमान नमस्कार. आपने हमें पहचान लिया? बिल्कुल पहचान लिया.
The campaign Swasth Chetna Abhiyan also organized Nukkad Nataks, which were placed outside all camps to generate awareness for NCDs amongst the maximum number of visitors. These Nukkad Nataks caught the attention of the visitors, generating curiosity and increasing footfalls at the health camps. With a focus on a healthier lifestyle, the camp's holistic approach went beyond just medical checks to include other activities like yoga sessions by various schools and skits by young children.
तो आप सबको हम इसके लक्षण बताएंगे और जिसके कारण आप ये जान सकते हैं कि आपको डायबिटीज की बीमारी है या नहीं है.
Spreading the health awareness drive amongst all the visitors at IITF, the Ministry of Health and Family Welfare also engaged the crowds with flash mobs, quiz competitions,
योगा डे कौन से डेट को होता है?
and drawing competitions at Pragati Maidan. Taking the online world by storm, popular social networking sites like Facebook, Twitter and YouTube were used to promote the Swachh Bharat, Swasth Bharat campaign for the Health Ministry of India, one of the biggest real-time online health campaigns ever in India. Maximizing its online presence, a special Android application for Facebook was developed, which generated a campaign banner on each user's Facebook page, creating a sense of association with the campaign and the cause, with 7 teams actively driving online participation and spreading the reach digitally amongst those who could not be at the IITF physically. As a result of these, there were 15 lakh Facebook impressions, nearly 7,000 logins on the campaign app, and the Facebook likes shot up to almost 14,000. This was the huge victory for the Ministry of Health and Family Welfare and NPCDCS in the battle against NCDs. And the day is not far when each citizen of India will be aware of the dangers of NCDs and will be living a healthy lifestyle. Our goal is your goal. Swachh Bharat, Swasth Bharat.